Well, hello and welcome, everybody. I'm Peggy Sundstrom with the Forbes School of Business and Technology, and this is our fourth presentation of the fourth annual Research Symposium. Thanks so much for joining in. We have a very interesting presentation today from Dr Ochoa, who's going to be describing his proposed study, actually a study he's just beginning, a case study examining occupational burnout and work-life balance strategies among chaplains. And Jonathan will move us through that presentation in just a minute. I'd like to encourage you to use the chat function to post any questions you may have. And in about the last 5 minutes of this half hour together, we'll take questions from the audience, and you can ask Jonathan about his study or make comments about the study. So thanks for joining us. This is our last presentation for today, but we have 2 more days of presentations on Wednesday and Thursday. So thanks for attending, and tune in next time as well. So Jonathan, welcome, and please take over and start your presentation.
Well, thank you so much, Dr. Sundstrom. A lot of kudos to you for helping me through the process, and I'm just really looking forward to the stage that I'm in as far as collecting data when it comes to this case study examining occupational burnout and work-life balance strategies among chaplains. Just to tell you a little bit about myself, of course, I'm a current student. I'm in the doctoral program, attempting to get my doctorate of philosophy in the human service program. And Dr. Ballard put it in the chat, but yes, just recently accepted a position as an adjunct associate professor in the human services program. So excited about that as well. I'm also the head discipline chief for the Health and Human Services Commission for the state of Texas. Just a really brief and quick, what that is just over 13 hospitals in the state of Texas, and just assist with chaplaincy, helping hire in the hiring process and things of that nature, helping train chaplains from all over. I'm also the director of spiritual care at North Texas Hospital, which I'll talk about here in a minute. I'm almost done completing my first book. It's called No U-Turn. Just a little bit about that, won't cover much, but it's just talking about the removal of barriers in order to experience a maximum manifestation in your life. I love to play ping pong. I've been playing ping pong for probably 16 or 17 years. I love to go to church. I love to help people, and I love to learn new things. So I'll tell you the next thing, just a little bit about myself. I've lived in Texas for 41 years. And I'll tell you the reason I'm telling you 33 years in Vernon, because there's a tie to the institutions where I'm employed, and then 8 years in Wichita Falls, Texas. I've been working over 20 years in the mental health setting, coming up on 21 years in August, and 10 years of that has been as a forensic clinical chaplain. So I get to the campuses, and if you look at the maps, you can see that the maps have little green stars. That's Vernon, and about 49 miles east of Vernon is Wichita Falls. And the reason I bring that up is because this is where I'm the director of spiritual care. The one to the right where I have my mouse, that's the Wichita Falls campus. That's where I'm housed. That's the biggest campus of all 3 campuses. Then you have the Vernon campus, which is the only maximum state security facility in the state of Texas. And what that means is that's just where the worst of the worst, probably individuals who've been found incompetent to stand trial come so they can receive competency in order to return back to the court system in order to face the charges that are pending. And then there's a little picture up above, and that's the adolescent program. And that program right there is just housing our adolescents. They're all 3 tied together. And weekly we work, another chaplain now, a chaplain that I supervise, who just do our best to provide spiritual care to our patients. Now I want to get to the case study, the research that I'm doing. I'm really proud of what I'm doing here, because I'm not doing it just to graduate school, but I'm actually doing it because I feel that it's going to help what I consider the problem that's going currently with the chaplains, not only that I serve, but the chaplains that are in an organization that I'll be talking about a little bit later. But if you look at the statement of problem, the specific problem is that chaplains typically do not have anywhere to turn to get relief from emotional burdens, spiritual guidance, and emotional needs, which could result in occupational burnout. Now, I want to tell you that if chaplains perceive that they have nowhere to turn for help, they may become emotionally drained and possibly emotionally disturbed and even begin to isolate themselves. I found some research that Holliday did back in 2001, and he conducted a study that found that mental health challenges that chaplains attempt to help mental health patients avoid often cause suffering for the chaplains themselves. And additionally, chaplains tend to set aside their own emotional needs when they experience stress and strain from functioning in multiple roles, such as a spouse or a partner, even a parent, a working professional, and a community leader while providing caregiving. So a chaplain's role can be burdensome and debilitating to the chaplain's own well-being if they have no access to sources of support for intentional self-care. And chaplains will also choose not to ask for or even access help because there's a family first rule of engagement that's in play, which means they're essentially putting others first before their own needs. Next, I'll go to the purpose of study. And the purpose of study is to explore how chaplains working in mental health settings can achieve work-life balance to care for their emotional needs and avoid burnout. The findings from the study are going to potentially lead to both specific information about how chaplains working in a mental health settings can achieve a healthy work-life balance and how they can seek to help prevent occupational burnout. The intent of the research that I'm doing is to identify the kinds of work-life balance strategies that help prevent occupational burnout, specifically in a mental health setting, including ways chaplains can seek help for their emotional needs. This research entails collecting data on the perceptions and experiences of those who supervise chaplains working in stressful mental health settings. So all of my research will be done with chaplain supervisors. Understanding supportive strategies which can be employed to achieve a productive work-life balance, I believe, will also be helpful in combating burnout within the chaplaincy field. CPSP is an organization called the College of Pastoral Supervision and Psychotherapy. And a part of the participants that I'll be choosing, they're going to be members, chaplains, actually a part of that organization. I'm looking for chaplain supervisors who have 3 or more years experience as a supervisor, and then also 3 or more years as a chaplain supervisor in a mental health setting. And I'm looking for 12 to 15 participants in that. I've determined this population of study to get down to the chaplain supervisors, because I believe they're the true source of what they're providing to the chaplains they supervise. I believe that these individuals who serve as chaplain supervisors, they'll be able to give the best information possible, not only about the mental health setting itself, but also how their chaplains are responding to them in the midst of avoiding occupational burnout. Now, some of you know these terms and very familiar with these terms. I won't cover many of them as long, but I will talk about them. And the reason I brought up that chaplain, this term, is so important is because when people tend to look at a chaplain, they automatically tie it with a pastor. And there's a distinct difference between a chaplain and a pastor. Your normal pastor is an individual who is tied into his specific belief in his denomination. A chaplain, in a nutshell, is one who serves others in their beliefs. And I hope that makes sense. So chaplains, they're considered spiritual care specialists, and they're trained in a unique way. I won't stay long on this, but they have to go what we call clinical pastoral training. They're called CPEs. And they get this training so they can set themselves up to discuss spiritual and essential issues that are geared or connected to individuals, not only those individuals in a patient type setting, but also their families and other members that may be connected to the people that they're serving. Chaplains are known to provide care in various settings like hospice. You've seen some in the mental health settings, you've seen some in medical hospitals. The populations vary. Occupational burnout is known as a psychological syndrome caused by a work-related stress and characterized by different types of behaviors. We know that there's different levels of emotional exhaustion and disconnection and even low personal accomplishment. Then we'll go to work-life balance. And these are familiar terms that I think a lot of individuals know, but it's good to have a refresher and good to get a reminder of what these things are, because work-life balance is understanding the importance of maintaining a healthy balance between the time devoted to work and the time devoted to maintaining family and personal obligations. Some research that I found showed that work-life balance will help develop a discernible balance between the workload and family time. Something that is interesting that I also come across with work-life balance, because I thought it was always a 50-50 thing. As long as you spend 50% at your job and 50% at your work, then you're good. That means you've separated them both equally. You're awesome. But no, I found out that it really depends on the individual. An individual may be able to spend 60% of his time at work and 40% of the time with the family, and that may go well with his spouse, and that may work great with those individuals. So it's something that I found very interesting about work balance is it's not a 50-50 thing. It's how you really are as an individual, and you're able to maintain your work versus your life balance. So I thought that was really interesting. We all are common with stress, and we know that stress is a bodily experience and a demand upon the body system that consists of psychological and these components that we have to be aware of, because we know that stress stems from awareness of burnout and demands from the environment upon an individual. And then stressors. We know that stressors are a strain or tension of the body to any demand a person must respond. Stressors can place a tremendous burden on work and relationships. For example, a chaplain caseload, maybe a sudden death with the patient or the family of a patient, and even a treatment team setting consisting of many different disciplines within those settings, like psychiatrists, psychologists, nurses, registered nurses, rehab techs, social workers, all these individuals who have to come together weekly to find out how they not only diagnose a patient, but how they're better serving the patient. We'll get next to the literature review, or I'll go into the research questions. I'm sorry, that's the next slide. But what kind of motivated me to get into this research was these research questions. And research question number one was, according to chaplain supervisors, what workplace stressors do chaplains experience when working in mental health settings? The next question was, what strategies can chaplains use to maintain personal and professional balance in a mental health setting? And the third question was, what resources should be provided to support chaplains working in mental health settings to help avoid burnout? Now I'll get to the literature review. There's two different slides on this one, and I kind of want to talk about the roles and the responsibilities, because I think it really ties into avoiding occupational burnout. The proposed study that we all are talking about, we know, is about how chaplains can maintain a work-life balance in a mental health setting to avoid occupational burnout. And there's been many studies done that have conducted on occupational burnout and what causes burnout. These studies have focused on how occupational burnout comes about and the response of individuals when dealing with occupational burnout. So the proposed study that I'm doing will expand on the understanding of what chaplains in a mental health setting can do to alleviate burnout from the perspective of those who supervise them. And since we know that a chaplain is a spiritual provider who uses certain concepts as active listening and advocating and communicating and interacting with no personal agenda, they spend a lot of time with not only patients, but employees and also families. We talk about the role and how much time is spent. So take that into consideration with this study. Chaplains have an important role to play, and in providing spiritual services for these patients. Remember, they're dealing with patients who have serious mental illnesses, or if they're in a hospice type setting, they're dealing with individuals who are on the last verge of a last breath, and they're having to take on how the families are responding in those instances. If they're chaplains who are serving in a prison type system, which also carry mental health individuals, you know what kind of environment and in the hostile environment that is in that position for a chaplain. So among all these in these places, in these circumstances that a chaplain is being placed in, we have to take consideration that a chaplain is responsible for creating collaboration and acting as a liaison, not only to, but also between the patients, the staff, and the family members. So in many cases, families may request prayer and other spiritual resources from chaplains. So a chaplain has to be ready to go at any given moment. I always used to tell my chaplains who, upon hire, that we're pretty much on a 24-hour call, because we really never get to go home and just rest, because all of a sudden you can get a phone call that it's time to return to work because maybe a death was or just occurred, or maybe the loss of a loved one of a family member. So it's just like, almost 7 days a week, 24 hours a day, where we're constantly just feeling like we're on the grind. And if you think about this, since these roles and responsibilities of a chaplain are to establish these family meetings and assess these patients for spiritual purposes, as well as support the work of the other traditional chaplains that they're supervising, where are we going to get this help on an individual basis? So take that into mind. We go back to work-life balance, because I found it very important that since we know what it is and what it's about, how is a chaplain going to seek a professional and personal work-life balance when it comes to the demands of work, family, and a personal life? Research that I found had shown that when we're adding a work-life balance, and this work-life balance is consuming, like the work-life balance was balancing the consuming nature of work with that of the quantity of work hours and the schedule and work obligations playing a part, a chaplain has to be mindful within himself of either where to go and how to go. But remember, if these sources aren't available, what is a chaplain to do? Individuals who have positive or productive work-life balance, they have balanced goals, and those goals focus on work-family interaction, work-family accommodation, work-life articulation, work and personal life harmonization, and even work-family segmentation. So research has confirmed that work-life balance resources help individuals positively, both within their organization, but also on a personal level. So when providing spiritual care in a mental health setting, facility has many challenges within itself, then that could lead a chaplain to experience this occupational burnout that we're speaking of. Patients typically come from a wide variety of ethnic and social, cultural, and religious backgrounds. So a chaplain, even though he may specifically has his own belief and tied to what he believes, that's thrown out the window, because we're not on our own agenda. We're serving a bigger population. So that means even a broader requirement of studying all the many different denominations and religions that are out there, so we can serve individuals at where they're at and maybe what belief they carry, coming up with biblical material or material that maybe we never even heard of but are having to learn about in order to meet the need of a patient. I believe that the proposed research study is important because providing spiritual care to patients in a mental health system, it's not an easy task. And chaplains may face many challenges striking the right balance when working with individuals who are ethically, socially, culturally, and religiously different than they are. So I want to go to the importance of the study. So the importance of this study is revealing how chaplains maintain personal and professional balance while providing pastoral care in a mental health setting. The information, I believe, is going to be useful to other chaplains, and I believe even other professions, to those who train and support chaplains in their work, or nurses or social workers. You take a pick. We're specifically on chaplains, but I think it's important because it's going to be useful to those who train and support in their specific work fields. In this case, in this instance, providing pastoral care in a mental health setting is very challenging. And chaplains work with care seekers who struggle with mental health issues. So understanding how chaplains can and should seek resources to meet their emotional and mental health needs, it's going to provide a greater clarity about the types of resources and supportive services that may be required for chaplains who may otherwise experience occupational burnout. So the research design that I decided to do, which I wish I could really give you the story and all that, because so much had changed and I was willing to take on the challenge. And we finally came to determine that we were going to focus on a single case study as a part of this research and how we were going to go about this. A single case study design is going to be used to answer the questions of how chaplain supervisors believe chaplains working in mental health settings should seek support for their emotional and mental health needs. The single case study design will help show the different strategies that chaplains can use to maintain personal and professional balance in a mental health setting. And I also chose to go with the single case study because I believe that it's going to focus on perspectives of chaplain supervisors who have experience with work-life balance strategies to help avoid burnout. Then we'll go to the data collection. There's two different ways of collecting data as a part of the triangulation process. And I chose to go with a questionnaire. And I'm really glad that I chose to go with the questionnaire. And then immediately following the questionnaire, I'm going to be doing a one-to-one interview with 12 of the chaplains that meet the requirements of the individuals that I'll be collecting data with. The questionnaire, it's of course going to be distributed and has been distributed through email. And it's going to ask participants to describe the kind of stressors explained or the kind of stressors they experience while they're working in a mental health setting. I think that's very valuable. I think that's very important. I think that it's awesome to know that while they're filling out this questionnaire, that we're going into understanding with the interview questions, getting deeper knowledge and deeper information, even more resources of how chaplain supervisors are dealing with chaplains that they supervise are dealing with occupational burnout. During the interview process, I'll be reviewing responses to each participant from the questionnaires and clarifying points that each of them have made. And after all the questionnaire data is collected and verified, then I will perform an initial compilation of the data from across all the participants. And these data points will be used to support and triangulate the data collected through these one-on-one interviews. Well, does anyone have any questions? You're on mute.
Sorry about that. I said that was a great presentation. Thank you very much. I know a lot about your study, and each time I hear you talk about it, I'm impressed with the idea that that burnout is more and more prevalent, particularly in people who are in service environments. So I think that this should be quite interesting. let's see here, several comments in the chat. In the social work profession, burnout prevention and self-care is emphasized when students are studying for their potential careers. Is this something that's done for chaplains? Supervisors are also trained to recognize and support this with their staff. Is this done with chaplains? In other words, is there an organized way of training people to prevent burnout?
At the current moment, there actually is not. Now, there is an annual conference that every chaplain is available to attend, and that has recently been a certain topic within our conference. I think it was 2 years ago where a guy who had a doctorate of ministry spoke on how to avoid burnout, but really never tailored into or segued into a healthy work-life balance. So I think that that's a great point to bring up, Ms. Sheila. So thank you for that. That our supervisors need to be trained in a position where they're able to provide that for the chaplains they supervise.
Right. And another comment said, might some of these work-life balance strategies that work for chaplains also be applicable to others in public service? And I think
absolutely
that you actually just answered that there is this continuity in terms of from one helping profession to another. Interesting, though, that there isn't anything specific for chaplains during their training. I wonder if one of the results of your study or impact of your study might be in encouraging that to happen. Have you thought about how you might use your study findings in your own profession?
I currently am. After my, of course, going through the preliminary oral defense, one of the interesting questions was asked, about how am I going to not be biased towards the individuals that I'll be doing research over. And my response to that was one of the difficult things that we take on currently is that when policy and procedure is set up with anyone working in a mental health facility within our institution, that we're not allowed to talk about anything that has occurred. So who are we sharing this information with? How are we taking the opportunity to release something that's really traumatic to maybe hold on to, depending on the situation or the circumstance. So, I've come up with some ideas that can actually be placed in our institutions to better equip individuals who need a form of release, not just chaplains, but actual staff members, because our facilities consist of RNs, psychiatric nursing assistants, social workers, psychologists, all the many different disciplines who have to release some way or somehow when they experience a traumatic event behind what we would call behind the fence.
Yeah. Interesting. Claudia asked a comment that said, has work been done to see if positive, strong family relations provide a buffer against burnout? In particular, have studies shown that healthy family relations make chaplains less likely to burn out? Has work on that particular question been done? Did you come across any of that in your research?
Yes, like I said, I really came across, it depends on the individual. This is sad to say, most chaplains don't like being at home because they may not have a healthy home life, and that's sad to say, but they may not have a great marriage. They may have a way at home that's not as healthy as wanting to be at home. So they go to work just to get away from home and vice versa. I hope that makes sense. So really, it depends on the individual. Now, I will say in particular, there are many individuals who have come across studies where when you are spending more time with your families and you are spending less time at work, then you do have less a chance of experiencing burnout. But like I said, now that we've gone through the pandemic, we know there's a lot of individuals who have spent more time at home who cannot wait to get outside the home because now they've spent way too much time and there's many different things that they've experienced.
Yeah, that's an interesting perspective. Lots of interest here. Another question is, do you think there's more burnout in a correctional setting, say, for example, than in a military setting?
say that question again?
Do you think that there is more burnout among chaplains in a correctional setting versus in a military setting? This question came from an individual who has a family member who was a military chaplain. So we're talking a little bit about the differences in the setting, because
Yes.
you're specifically looking at mental health settings, right?
Yes. Paul, thank you. That's a great question. And I want someone to take this in mind, because I think it's very awesome to know, well, what kind of individuals are in a mental health setting. And honestly, all types of individuals. You have individuals who maybe been in the military. You have individuals who used to be nurses, used to be lawyers, used to be doctors. And at one time or another, they experienced some traumatic event, maybe a wreck that caused head trauma, or maybe some deep end off the, because of depression or going through a struggle in life. So in particularly, burnout to me is the same across the board, because every individual can experience something within their life that can cause them to be in a mental health setting. So I think in the military setting, and your brother or whoever your family member is can probably vouch for this, that there's a lot of military individuals who suffer from PTSD, who don't know how to cope in society because of the struggle, and then they end up in a military type setting. So chaplains are not only having to deal with them in a military type setting, they're also now having to deal with them in a mental health setting.
Wow, this is a fascinating discussion, and I'm sure we could go on for quite some time. You can see some of the comments. Jonathan, do you have contact information on the next slide? Yes. There. So those of you who didn't get a question answered directly, I'm certain that Jonathan would be more than happy to respond to your question via email. Jonathan, I'd like to thank you for a very interesting presentation, very nicely done. And thanks to our very active audience, really appreciate the input. And again, congratulations on that new position in human services. Jonathan's degree is a PhD in human services. And so there's a natural linkage there. Terrific opportunity to share your expertise. Ladies and gentlemen, this is the end of our first day of the Research Symposium. Thank you so much for joining us. As I have mentioned to other audiences, we do have a series of e-posters that you can find on our Research Symposium website. And the Zoom presentations, such as this one, will be linked in our YouTube page. It'll probably take us a few weeks after the symposium to get those up, but you'll also be able to go back and see this presentation and any others that you might be interested in viewing. So again, thanks for your support for the 4th annual UAGC Research Symposium. Thank you, Jonathan. And to everyone, please join us again tomorrow morning, Wednesday morning. We start again at, let's see, I have to convert my times. We start again at 10 a.m. Mountain Daylight Time on Wednesday, and again on Thursday. So please join us for those. Thank you very much and have a great day.